My name is Leonardo Basso. I am the director of the Institute Complex Engineering Systems, a multi-university center devoted to research, innovation, and societal impact. In this presentation, we will show how an early partnership between the Chilean Ministries of Health and Science, ENTEL, the largest telecom company in the country, and the Institute developed innovative methodologies and tools that placed OR and analytics at the forefront of the battle against the COVID-19 pandemic. This provided guidance for several key decisions in each of the three pillars of the Chilean strategy against the virus: contagion prevention, nationwide centralized management of critical beds, and vaccination. Specifically, and as the pandemic progressed, we used advanced methods from statistics, machine learning, and operations research to, first, shed light on the actual effects of lockdowns in different municipalities and over time. Second, help allocate limited intensive care capacity. Third, significantly increase the testing capacity and provide on-the-ground strategies for active screening of asymptomatic cases. And fourth, implement a nationwide serology surveillance program that significantly influenced Chile's and the world's decision regarding vaccine booster doses. We will also show that this project is probably unlike others you may have seen in the past, as it faced important challenges: urgency, given the fierce progression of the pandemic; coordination at the national scale of large and diverse teams; and nurturing trust in an anguished population through effective communication. As we mourn our dead and our thoughts go to so many that lost someone, we will show you how this partnership between government, academia, and the private sector used OR to contribute to curb this crisis. We will show how analytics saved lives in Chile.
An excellent example of how the scientific community contributed to the pandemic is also provided by applied engineering, which is directly linked to the work of the Institute. One of them is their studies on mobility, which helped us understand the behavior of the population during lockdowns. And now we understand the advantages and also the limitations of lockdowns. Another project, the serology surveillance, provided critical evidence for a boosted dose in our vaccination strategy.
During the first wave of 2020, we saw a large disparity in the effectiveness of lockdowns across regions, even within the same city. Seeing this, it became clear that we needed indicators, other than new cases, to quickly evaluate the effectiveness of the lockdowns, because waiting to observe the evolution of cases proved to be too late to contain outbreaks. This is when we had the idea of using mobility data to anticipate infection outbreaks. Following the logic of an epidemiological compartment model, mobility is a proxy of the rate of transmission in the community. We first thought of using the mobility reports constructed by Google, but these were not sufficiently granular to monitor mobility at the level that the lockdowns were being implemented.
Mi nombre es Antonio Moreno y soy gerente de ENTEL Ocean. En ENTEL siempre hemos creído que la forma de resolver los grandes desafíos o innovaciones es mediante alianzas público-privadas, para que en conjunto ayudáramos a resolver el gran desafío de entender la movilidad durante la pandemia. El resultado alcanzado nos permitió transformar data de la red móvil, anonimizada y agrupada, en un visor territorial que nos permitía entender la movilidad durante las cuarentenas, mediante una plataforma digital abierta.
By the middle of May, we had a worrisome occupation rate of ICU beds of more than 95% in the capital city of Santiago, where most of the cases were concentrated. Suddenly, ICU capacity planning became a first-order concern. On May the 12th, we were urged to prepare short-term forecasts of the ICU bed occupancy for those regions with the highest utilization rates. Within 24 hours, we submitted our first report. From then on, we continuously refined the methodology and prepared forecasts every 2 days during the whole duration of the hospital crisis. Our forecasting system helped the Ministry of Health to implement a progressive increase in the number of beds, resulting in more than doubling the capacity in the most congested regions.
The idea behind the technique is quite elegant. You combine samples from a group of individuals and test using a single PCR reaction. If the result is negative, everyone is clear. Otherwise, you test everyone individually. When positivity rates are low, a negative result is much more likely, which effectively increases the testing capacity. And that was precisely the situation in Chile by the end of the first wave. So this presented a huge opportunity. Going from theory to practice took a few steps. First, the technique was validated for COVID at the lab level by our partners at the Faculty of Medicine of the University of Chile. Then, we piloted a testing monitoring program at long-term care facilities. The pilot was a huge success. By the second half of 2020, testing efforts focused in identifying asymptomatic cases. And for that, the government strategy involved placing mobile PCR testing stations in public spaces throughout the cities. We developed a system to help efficiently locating these stations by combining mobility and epidemiological data at a census block level. The system was built around an active screening index called the BAC index that estimates the likelihood of finding asymptomatic cases in some public space at any given time. The BAC index was updated on a weekly basis and was integrated into the Ministries of Health visualization platform in the form of heat maps, where darker regions indicated regions with a higher chance of finding asymptomatic cases. After a successful pilot in October 2020, the index became a key component in active screening efforts nationwide, starting in November 2020.
The Ministry of Health had provisioned thousands of rapid-to-use COVID-19 antibody detection tests, initially considered but subsequently discarded for individual use. How could we use these tests in a reliably, methodologically sound manner? The engineers had generated a mobile phone-based mobility program, together with partners from industry, which reliably allowed to identify geographic spots in a given city, a main plaza, for example, visited daily by individuals coming from most, if not all, localities within the city. For the first time, in near 60,000 participants, that Sinovac and Pfizer vaccines provided a robust immune response by 2 weeks after the second dose. But the positivity declined significantly for Sinovac within 6 months, a decline which was less pronounced for Pfizer recipients. This data support the strategy of a third dose for Sinovac recipients in Chile, a strategy now implemented worldwide for most vaccines. And we have continued.
The project achieved innovation excellence, which is remarkable considering the pressing conditions under which it was developed. Given the urgency and the stakes, there was no time for a minimum viable product that could be iterated and improved. Our team built a reliable system that could support proactive decision-making from the get-go in a record amount of time.
This evidence-based decision-making experience is an example of multiple future uses and public policy that this technology may have. Also, in the face of future health emergencies, such as the uncertainty of new virus, having this experience supported by evidence and science will be essential for the work of health teams. This collaborative work had a strong impact on the response capacity that we have developed as a country to face the pandemic.
La pandemia nos hizo evidente la necesidad de la ciencia y la analítica en la gestión de las políticas públicas para respaldar de mejor forma la toma de decisiones. Estamos muy entusiasmados de continuar con estas colaboraciones, utilizando la ciencia y la analítica para respaldar la toma de decisiones en la pandemia y, ¿por qué no?, en otros desafíos que la salud pública nos indica que debemos enfrentar.
Lo que ha hecho el Instituto de Sistemas Complejos de la Universidad de Chile es tremendo, ha sido de un apoyo fundamental que ha salvado vidas y nos ha permitido hacer mejores políticas públicas. Y es por eso que apoyo su postulación al premio Franz Edelman, pero no solamente apoyar la postulación a un premio, sino decir de que cuentan con nosotros porque este gobierno va a estar también al servicio de la ciencia.
Critically, and as we showed, the project saved millions of dollars, avoided thousands of infections, and in a conservative estimate, it saved more than 2,000 lives.